All right, everybody, we're going to start the chapter of rehab and reconditioning. This kind of falls in line with this portion of the class because it'll talk about what you need to understand in terms of when someone's going through rehab and how rehab is actually connected to the strength conditioning uh, world, essentially. And if you have any thought processes on these type of things or why we have to do what we do, it's good to understand this type of a chapter. So we're going to identify members of the sports medicine team and what are their responsibilities. Recognizing some of the types of injuries that athletes will sustain. Obviously, we're not going to go through all the injuries, just some common types of injuries. Then comprehend the timing and events of tissue healing. We're also going to understand the goals of each tissue healing phase and describe the strength conditioning professional's role during rehab and reconditioning phases. So what are the principles of rehab and reconditioning? Essentially, it's healing tissues that must not be overstressed. So in other words, for us to actually heal, we have to start putting that joint or that muscle or whatever it might be that's injured through a little bit of something for it to start getting back to where it was. Now, our big goal here is just that we don't overstress it. That way we don't re-injure it or we delay the process. But sometimes the movement of the joint or the muscle or whatever it might be actually helps speed up that recovery. The athlete must fulfill specific criteria to progress from one phase to another in the rehab process. So we have these goals set out because we need to make sure that they're hitting certain criteria that we would deem good enough to move on. Why? Because if you simply just were to ask an athlete, hey, how are you feeling? 9 times out of 10, they're going to lie to you and tell you that they're feeling better than they actually are. Then they're going to try to go and overdo it, and they're going to re-injure themselves. Okay? So we need to make sure that we understand what these steps are and that we're actually following them to a T pretty much. The rehab program must be based on current clinical and scientific research. Basically, what we're saying here is that it needs to be pretty standard in kind of what's being out there for rehab of the certain injury, because if we start to try to get too cute and if we try to get too game changing, so to speak, we again will run that risk of re-injury or not progressing to the extent that we want to progress. The program must be adaptable to each individual and his or her specific requirements and goals. For instance, if we have an ACL tear of a high school athlete who might not have a future playing college ball, it's going to be different than that of a ACL tear that of a high school athlete that has college ball aspirations, so on and so forth. Are they getting the rehab for the position or the injury because they're just trying to get their daily life back, or are they trying to actually perform at a high level, essentially is what we're saying. And when you have these types of injuries, typically the joint or muscle injury, it's kind of the same for everybody to an extent. We have to kind of follow the same guidelines. It's just a matter of how hard do we push or what intensities may be utilized depending upon the person's overall goal. And the rehabilitation is a team-oriented process, meaning it's not just you and it's not just the rehab or the PT. It's a lot of people that are actually together on this team to make sure that those criteria that we just talked about are being met. Okay. So who is that sports medicine team that we continue to talk about? And when we look at this chapter, this gets a little bit more specific in the terms of when we talk about a sports medicine team, this is where this chapter kind of talks and looks a lot more like stuff at the collegiate or professional level where they have these teams in place. But you think about it, you have to work with this all the time, even if you're a coach at a normal small school, high school, and a kid gets injured. You need to make sure that you're talking with whoever they're training with or rehabbing with to make sure that everything goes okay. Or that physical therapist is already doing a lot of this job to make sure that the kid or the individual progresses to where they don't over injure them or re-injure themselves, or um, have the cause for potential greater injury. So all members of the sports medicine team are responsible for educating those coaches and athletes regarding injury risks, precautions, and treatments. Basically, if you participate in sports, you run the risk of injury. That could be as simple as that. Um, they also work to prevent injuries and rehabilitate injured athletes. So the reason we have strength conditioning professionals technically on that sports medicine team is that the training that we do or what we put athletes through should be geared towards reducing injury. Why? We want them to be stronger. We want them to be more flexible. We want them to be able to put their body in positions that they can handle. And altogether, that helps, prevent injuries. And then whenever we are rehabbing injuries, who do you think is the one that's helping put the athlete through the workouts? Typically, it's either that PT when it's on that side, and then once they get cleared to start activities again, we don't start them at 100% go all the time. We start them way, way back, kind of low intensity. But guess who's putting those workouts on? It's that strength conditioning professional. Several different professionals play important roles, obviously, but effective communication is the biggest key to all of this. If there's no communication between the people we're about to discuss, then that's how athletes get cleared too fast, or re-injury occurs that could have been avoided. So who are they? Team physician. So this one is a person who provides medical care to an organization, school, or team. We have the athletic trainer, a person typically responsible for the day-to-day physical health of the athlete, and they typically need to be certified by the National Athletic Trainers Association Board of Certification. So an ATC, Certified Athletic Trainer. We have the physical therapist, a person with a background in orthopedics and sports medicine who can play a valuable role in reducing pain and restoring function to the injured athlete. So sometimes they're utilized on a, more regular basis just to kind of get things, little nagging injuries out of the way and rehab those. But if we have someone that goes through surgery or whatever, they're typically going to see a physical therapist before they come back on to see the strength conditioning professionals. Your strength conditioning professional, basically a person who focuses on strength, power, and performance. These individuals need to be certified by the NSCA as a certified strength conditioning specialist. Once again, it to help protect you and the athletes. That's why we want people to be a certified athletic trainer. We want people to be nowadays a DPT, or a doctor of physical therapy, a strength and conditioning specialist, right? All of it comes with basically protections for you and that athlete. We have exercise physiologists. Those would be people more like on my side of things, who has a formal background in the study of the exercise sciences and uses his or her expertise to assist with the design of a conditioning program that carefully considers the body's metabolic response to exercise. Essentially, we're kind of that middle ground. We kind of tell people what's being used and what is the most efficient, what can they do, what is their body going to go through. That way we don't overstress maybe a possible different area of the body and cause injury there, okay? Nutritionist, person with a background in sports nutrition, they need to be a registered dietitian. If you're not a registered dietitian, you cannot give out nutritional plans. No ifs, ands, or buts. If you are a nutritionist, you can give suggestions, but you cannot tell people a specific thing to eat, okay, unless you're a registered dietitian. Psychologist and psychiatrist, a licensed professional. This is just going to help those athletes in that mental state, because once they go down with an injury, sometimes they get into some bad mental states, and it's those bad mental states that will sometimes hinder our rehab. Maybe it's because they get weighed down on themselves, and so they don't put all their effort into rehab, or vice versa. They try not to get into that spot, so therefore they push themselves too hard and regress in the rehab process. So when we're talking about communication, that strength conditioning professional must understand the following. You need to understand the diagnosis of the injury. Now, I'm not sitting there telling you that if someone were to hand you an injury or a diagnosis that you need to know exactly everything. You just need to understanding, okay, a communication with doctors, PTs, everybody involved. What was the diagnosis? Okay, lower body, this or this, whatever it might be, understanding it so now you can start to plan for it. Okay, that might include what are some of the things that we need to avoid and what is it that they're going to need to help with that might not just be injury side anymore, but now because of the injury, we've weakened something else, so we need to be careful with it. Indications or forms of treatment that are required. So what's the athlete going to have to do? And then contraindications, anything that could be prohibited due to the injury or could cause re-injury right off the bat. They must also perform the rest and inform the rest of the sports medicine team about the exercises performed. Basically, the reason we do this, and again, it's that communication, is if I give you a list of 5 exercises that we did today, and all of a sudden you go back to the doctor the next day and the joint is swollen, right? And it's hot, it hurts or whatever, that physical therapist or the doctor that the athlete's going to see needs to know what you did. Because based off of what you did, if the injury does something or if the site of the injury is doing something, whether it's swelling or whatever, that might be something that was not anticipated, and therefore they reduce the amount of activity that that person can do. That maybe the joint wasn't ready. The muscle wasn't ready to do that level of activity, so they draw it back. Or at least to sit there and say, okay, you did this, and we haven't seen any swelling, we haven't seen any aches and pains. All right, continue doing this. It's a good thing to do. But we need to know exactly what they're doing. That way we can try to pinpoint what's going on. We basically have talked about that. So let's talk about the types of injury. Macro trauma is going to be a specific sudden episode of overload injury to a given tissue. So once again, macro meaning big. So this is going to be a big tear, um, uh, tearing of the muscles, tearing of the joints, breaking of bone, stuff like that. That's going to be a macro trauma. We have dislocations. That's going to be a complete displacement of the joint surfaces, as opposed to a subluxation where it's a partial displacement of the joint surfaces. And typically what happens there is dislocation means that there's a displacement and they're not together. Subluxation, though, however, means that they could have had a dislocation and then slid back into place, which causes another damage, and they're not fully together again. Okay, so it's just a partial displacement at that point. A sprain is a trauma to a ligament, classified as a 1, 2, or a third degree, depending on the severity. And depending upon the severity, depends on the amount of time that athlete will be out and what we need to be doing to speed up that recovery. A contusion, it's a musculotendinous injury caused by direct trauma, also known as a bruise. Strain, tears in the muscle. Okay, that is a difference between a sprain and a strain. A strain is going to be a tear in the muscle fibers caused by indirect trauma that are classified as 1, 2, or 3, depending upon the severity. And then we have micro trauma. So that's going to be an overuse injury caused by repeated abnormal stress applied to a tissue by continuous training or training with too little recovery time. So you can have little nagging injuries such as micro traumas. A stress fracture, most common type of overuse injury that occurs in bones. So this one is going to be people that you see a lot of it in track where they log a lot of volume as far as mileage is concerned, and they don't really rest or eat properly, potentially following all that, and they just do it over and over and over. Stress fracture is one of those things that will occur. Tendinitis is an overuse injury that results in inflammation of a tendon. So with that being said, let's talk about tissue healing. All tissues follow the same basic pattern of healing. You're going to have inflammation of the site, you're going to have repair of the site, and then you're going to have remodeling that occurs. The timing of events within each phase of healing differs for each tissue type and is affected by a variety of factors. What is your age? Okay. What is your lifestyle? Did you get hurt, or is the injury occurring to you and you're typically sedentary? You're probably going to have a lengthier type of um, recovery process than somebody that may be highly active. Okay, they're a little possibly a little healthier, just more active. Degree of the injury. Is it a first degree sprain or strain, or is it a third degree strain or sprain? Okay, and the structure that has been damaged. If it's something that we can sit there and actually rest and rehab and discontinue the use of it somewhat, it's going to heal a lot faster than something that is in a spot of the body where there's no way around using it, right? Or to be able to do any other type of movement, that has to move. Therefore, it's constantly being used during its injury and repairing process. That's going to mean that it's going to take a little longer to repair. The process of returning to competition following injury involves the healing of the injured tissues, preparation of the tissues to return to function. So we need to make sure that they're ready to be doing what they're doing again. And then use of proper techniques to maximize that rehab and reconditioning. That's why we don't like for individuals to sit there and as soon as they're initially cleared, go play a full game at 100%. Why? Because the body's not ready for it. It hasn't been conditioned to do that type of stuff. That's why whenever you see individuals that are maybe having contract disputes, let's say football, for instance, and they skip training camp and preseasons type stuff, when they try to come back and play full go right after the contract, they're not in shape. Yeah, sure, they've been working out and doing stuff like that, so they are in shape, so to speak, but they're not football ready. Okay, there's a different type of conditioning in that point. The joints aren't ready to withhold that and upstand what's going on. Okay, so we need to make sure that we're hitting certain points to get them back. That way, whenever they do go back at 100%, likelihood of re-injury is not going to be involved for that purpose. Not to say that you can't get re-injured or injure yourself again, but we're going to do our best to make sure that it's not due to us speeding you back to the field. So what happens? During that inflammatory phase, we have pain, swelling, and redness. That's okay. That's what you want. When that starts to shift, during that time, we also see decreased collagen synthesis and an increased number in inflammatory cells. Then we shift into the fibroblastic repair phase. This is where we're going to see collagen fiber production, decrease in that collagen fiber organization, decreased number of inflammatory cells. Then we move into that maturation and remodeling phase. That's where we're going to see proper collagen fiber alignment and increased tissue strength. Again, all of this depends upon the site of the injury and the severity of the injury, of how fast and how long it takes for us to get through all these different pieces. So during that inflammatory response phase, inflammation is the body's initial reaction to injury and is necessary for that normal healing to occur. That injured area becomes red and swollen because we start to see first of all, there's trauma to the area, but we also start to see a rushing of fluids and other types of items, cells, and stuff like that into the actual injured area to start that inflammation phase. That inflammation is actually okay. It's what we need. Technically, when we work out, the soreness and everything else that we're doing, it's inflammation. Okay. Then we'll shift into that fibroblastic repair phase. Once that inflammatory phase is ended, tissue repair begins. So we haven't really started repairing yet. We've really just been prepping the area for the repair. This phase allows for that replacement of the tissues that are no longer viable following the injury. Think about it. When we have an injury, it could be that there's partial fraying of ligaments, tendons, whatever it might be, stretching of the ligaments and tendons. So we need to get rid of some of it, or at least it doesn't. What happens is that we don't heal that portion, right? We heal what's left to be healthy. And this phase of tissue healing begins as early as 2 days after that injury and may last up to 2 months. So once again, we may not ever be 100% in a couple of weeks. It might take more than that. And this is only the second phase. We haven't even hit that maturation phase, right? So the fibroblastic repair phase could take up to 2 months to complete. Then we move into that maturation and remodeling. That weakened tissue produced during that repair phase is now going to be strengthened. We're going to be more active during this time, doing what we need to do to strengthen that tissue that has been healed to make sure that it's ready to go again. And sometimes tissue remodeling can last up to 2 to 4 months after that injury, especially if we're something. This is why you think about it, why we let people do that active rest and the rehab after a season is because typically some of the smaller injuries that follow the same kind of a timeline where it could be 2 to 4 months. I mean, really and truly, are you going to put someone out for 8 weeks due to the sprained ankle or 16 weeks, miss an entire season due to a sprained ankle? Odds are no. But what we're going to do is we're going to let you rest it and get it healed up enough. And then we're going to do other types of things, whether that is taping the ankle or whatever it might be, something to kind of mitigate any more damage that we could be doing. That way you can play, and then we'll worry about everything else during that off-season time period when it's not as important, okay? But you got to make sure that you're not overstressing it. We are going to want to put stress onto that healing tissue to make sure that it's building itself up and getting stronger, but we don't want to overstress it. Therapeutic stress is necessary, especially for that collagen matrix. And that's why we need to meet those specific goals. If the athlete's not meeting the goals, we cannot clear them. No matter how big of an athlete they are, no matter how big of a star, how much they plead with you, if they're not meeting certain requirements, they cannot go, okay? During that inflammatory response, the treatment goal is preventing disruption of new tissue. So essentially, we're trying not to do anything during that time. General aerobic and anaerobic training, resistance training are the uninjured extremities. So if it is on a single side, you can avoid that side as much as possible and do single-sided or bilateral exercises, unilateral exercises, with priority giving to maximal protection of that injured area. Basically, what we're saying is if you start doing stuff while it's still in that inflammatory phase, it's going to take longer to get out of that phase. And the longer you take to get out of that phase, that means the fibroblastic repair phase is going to be longer, so on and so forth. During that fibroblastic repair phase, our treatment goal, we're preventing excessive muscle atrophy and joint deterioration in the injured area. So maintaining muscular and cardiovascular function in the uninjured areas. Again, you are still able to work the rest of the body to what extent you can based off of working around that injury without putting yourself at risk. But yet now we're starting to utilize that injury. We're trying to get strength in it. We're trying to build up the muscle within and around the area to make sure that we're not causing any other damages based off of atrophy or deterioration of the joint articulation. Exercise strategies, again, submax isometrics, isokinetic exercise where we control everything, and then specific exercises to improve neuromuscular control. So once again, you're kind of going to have to relearn. It's going to go a lot faster, but neuromuscular control to make sure that that part of the body is now able to withstand what you're going to be trying to put onto it. That's why we have to wait and do certain things, and then we'll learn how to start. We have to learn how to jog, then we'll learn how to run, okay? Once we learn how to run, then we can learn other things. Maturation and remodeling, the treatment goal is optimizing that tissue function by continuing and progressing the activities performed. And then our exercise strategies are going to be transition from general type exercises to more sport specific exercises. Okay, we want to strengthen the body. That's going to be in those general exercises. And then we're going to start rebuilding it to be able to withstand what we're doing in a sport related fashion. Specificity of the movement speed and an important variable. So we want to make sure that you can progress in terms of speed. If you're trying to cut, meaning go to one direction and kind of stop and cut and explode going the other direction, that's fine, but we're going to start by going slow and then stopping and then turning and pushing off, right? We're going to slowly do that. And then we're going to get a little faster and a little faster to where we're building up to the point where we want to go at what the important speed is. I want to go as fast as I can, stop, slam, cut, and go the other way. That's going to be at the very end. Why? Because if we were to try to do that right away with someone that had an ACL injury, boom, that ACL is gone in a heartbeat once again. Okay, so we don't want to speed it up too fast, but it is important to start building towards that speed of movement. And then the velocity specific strengthening exercises. Again, same kind of thing. You need to progress slowly and within stuff that is sport specific. So sample progression. This is going to be for somebody, basketball players recovering from ankle sprains. So we would start with A, can they withhold themselves on that ankle, that injured ankle? Why? That's going to be balanced. That's going to tell us that the joint is somewhat stable. Okay. Once they're able to perform that, we're going to do this right here. B, calf raises or toe raises. Why? Because now we're putting that joint through another range of motion. Then we're going to move to C, skipping. Why? That's going to show us that we can land on that ankle, that injured tissue, and explode off that injured tissue in a controlled and slow manner. What are we going to do next? Once we learn that we can do that, then we can learn how to jog. We're going to go a little faster. So now we're putting a little bit more speed to the movement, and it's taking all different aspects of what we've previously done and putting it into a full motion. We need to know what a closed kinetic chain is. A closed kinetic chain is an exercise in which the terminal joint meets with considerable resistance that prohibits or restrains its free motion. That's going to be that distal joint segment is stationary. So a deadlift, closed kinetic chain exercise. Squat, closed kinetic chain exercise. The push-up is a closed kinetic chain, meaning that this distal joint that is involved is stationary. It's not moving and it's not free to move throughout the activity of the exercise. Okay, same here with the wrists. They don't move, right? The elbows move, the shoulders are moving, but those wrists are not moved in the sense that they're not free to move, and you can't just move your hand around while you're doing a push-up. You can't move your feet around while you're doing a squat. Those are going to be your closed kinetic chains. An open kinetic chain is going to be the opposite. It's going to be an exercise that uses a combination of joints, but that distal or that terminal joint is free to move. So notice here, we're really working the quads on this leg extension. And yeah, that weight or that padding is right there on the ankles. But if he wanted to, he can turn his feet in. He could, kick his toes all throughout the manner of the movement. And it doesn't matter. It's not what is important. Okay. Because there's no resistance coming on the soles of his feet, that is an open kinetic chain. Sprinting is an example of both an open and a closed kinetic chain acting together. So at some point, whatever foot is pushing off, that's going to be closed kinetic chain, while the other one that is in flight is an open kinetic chain movement. So when we're talking about rehab and we're talking about the program design that you would look into possibly for rehab and reconditioning, several programs have been developed. One of them is the nowadays we just call it the APRE. There's no more of the DeLorme, so there's no more of that D on there. But essentially what it is a autoregulatory progressive resistance exercise, meaning that its manipulation of its intensity and volume is based on the person, meaning we're all going to be doing the same program, but it shifts based on how I perform on a day-to-day basis, rather than you telling me that we're progressing from 50% on Monday, 55 on Wednesday, 60 on Friday. I can go up or down based off my performance. So with that, we do something where it's, the first set is 50% of the estimated 1 rep max. So even then, that's pretty light. Okay. So you almost view the first 2 sets, because they are dictated weight, as almost essential warm-ups. That third set, you're going to do repetitions to failure at 100% of your 1 rep max. So typically, if you're doing the 1 rep max, it's going to be 1 to 2 probably. Okay, unless you've gone up and progressed internally based off of adaptations, and if you bust out more reps, then we will increase the amount of weight. And then you just do another 4th set that is to failure, and based off the number that you get, that's going to be your new rep max for Wednesday. And then you do 50% of that, 75% of that. So it's one that really goes in and allows for you to have a good day in the gym and you get rewarded, right? And also you can have bad days in the gym. I mean, we've all done that, right? Where we go into the gym and some days the weight we're moving around just feels so light. And you feel like you've kind of like, wow, man, that's awesome. But then you can go in the next couple days and then you do all that again and you're like, I can do this weight. I did it on Monday. And it's like you couldn't even lift it off the rack, right? So it's something that allows for you to progress at your own rate rather than somebody speeding you through a progression. So again, and here's just an example of the different, how we would change the weight based upon the number of repetitions that they complete. And then if we're looking at aerobic and anaerobic training, research is yet to determine an optimal aerobic training program to use in a rehab setting. Once again, it's all dependent. Obviously, if you're trying to run and you had shoulder surgery, the problem there is that you don't want that joint just free swinging and being overused and tiring out, essentially what's happened. So how do you run with that? Do you just pin it up? Well, okay, so now if you pin up your arm, yeah, that's not moving, but now my overall mechanics have changed. Now we run the risk of re-injury or producing an injury somewhere else. So it's kind of hard to tell what we could do. Now, if you want to sit there and say maybe utilizing the bike, okay, or the pool, again, just making sure that what you're doing is not going to cause further injury. And then the program should mimic specific sport and metabolic demands eventually, okay? When you're designing them, for injury that requires the strength conditioning professional to examine rehab and reconditioning goals, a lot of which is what are the goals that we're trying to meet, meaning those different criteria. Now, whatever the physical therapist and the doctor say, some of them may have you down with a phase 1, I want you to work this, and we're going to test, and you need to complete A, B, C, D before you move to phase 2. Some of them may have 3 phases. Whatever it is that the doctors have tried to put together that they want you to make sure that you can do without pain or swelling, any types of issues with the injury, that's what the strength conditioning professional needs to gear their workout around. okay? And you need to understand that it's not going to be going at a full 100% squats all the time. It might be something like with shoulder injuries, 5-pound weights. Those things will burn your shoulders off. I'm not kidding. Bands. It might be band work. Okay. So it just needs to make sure that you are paying attention to what the other team members are saying that needs to happen. And then you can program towards that. We need to reduce that risk of injury and re-injury. So previous injury is the most substantial risk factor. So risk factors for upper extremity injury, decreased glenohumeral range of motion. So that's going to be your shoulder. Scapular dyskinesis, so movement of the scapula, then decreased shoulder strength. So if you have a decreased shoulder strength, I hate to tell you this, but really and truly, while they might not be the strongest, the shoulders run the gamut of everything. You do a chest exercise, shoulders are moving. You do a back exercise, the shoulders are moving. Okay? If you have a decreased shoulder strength, your odds of making or having an injury do go up. Risk for that lower extremity, decreased balances, okay? Decreased neuromuscular control during the jumping and landing. That's going to be huge because if you don't have that aspect, then you can cause the injury of to the knee. Decreased lower extremity muscle strength. So again, we need to build up that muscle strength around the joint possibly to decrease any type of further injury. Structural programs should be specific to that sport demands. Once again, those will be in time, but sometimes you need to make sure that the balance is key. Can they jump and land properly if it's a lower extremity? And have we increased the muscle strength around the joint injury? So once again, with rehab, it's basically understanding that you have to start small and build slowly. You need to hit certain points before you progress further. So it may be kind of a wish in one hand, want in the other kind of situation on how you program weeks in advance. Or you may just be having specific, I want to do this, 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 because those will lead you to strength in an area and get us to be to those criteria that we're looking for to move on to the second phase or whatever it might be. Overall, your biggest thing is just making sure that you're not doing things that will re-injure the individual. That's your biggest key. All right. So with that being said, there's only 2 other chapters left, and that's going to be the 2 that are over the facilities. And those will be the last 2 videos on here, and then those will help you with your group project on the facilities. So again, guys, if you're having any issues or if you have any questions regarding the program or the facilities moving forward, please email me. I will Zoom message with you and your teammates. But email me, let me know what you need so we can get everything, because just because you have it doesn't mean you're the only one that has the question. So it might be something that I need to address to the class. With that being said, be on the lookout for the next 2 videos. Have a great day.